Hey everyone, I'm pumped to bring you this awesome NCLEX RN practice session. You're putting in the hours, studying like crazy, and the pressure is definitely on. But guess what? You got this. Stay positive and focused. We're here to help you crush it with 5 must-know practice questions, complete with detailed explanations. So grab your study buddy, get comfy, and let's dive right in. Ready? Let's go! Alright, future nurses, let's jump into our first question. Imagine you're on the floor and a client comes in with hypokalemia. Potassium is super important for our bodies to function properly, especially for our muscles and nerves. Now the question asks, which food should the nurse encourage to increase dietary potassium? Take a look at your options. Options are apples, bananas, white bread, and cheese. The correct answer is bananas. Bananas are packed with potassium, which helps those muscles relax. Encouraging your patient to munch on some bananas is a great way to naturally boost their potassium levels. Next up, we're tackling hypovolemic shock. This is a serious condition that can happen when there's a rapid fluid loss in the body, like after a major surgery. Which sign should send alarm bells ringing in your head, indicating they might be developing hypovolemic shock? Options are bradycardia, decreased urine output, hypertension, warm and flushed skin. The answer is decreased urine output. When the body goes into shock, it tries to conserve fluid by reducing urine production. If you notice your patient isn't going as often as they should, that's a red flag. Along with decreased urine output, keep a close eye out for other signs like a rapid heartbeat, tachycardia, and low blood pressure, hypertension. These are all signs that the body is struggling to compensate for the fluid loss. Next question. Type 1, diabetes and blood glucose. Let's shift gears now and talk about diabetes, specifically type 1. This type of diabetes is an autoimmune condition where the body's immune system attacks the insulin-producing cells in the pancreas. Remember, with type 1 diabetes, the body doesn't produce enough insulin, which helps regulate blood sugar levels. Insulin is crucial because it allows glucose to enter cells and provide energy. Imagine you're caring for a client with type 1 diabetes who reports feeling shaky and dizzy. These symptoms can be alarming and need immediate attention. These are classic signs of hypoglycemia or low blood sugar. Hypoglycemia can occur if the person has taken too much insulin or hasn't eaten enough. What's your priority intervention? The first step is to stay calm and act quickly. Your options are GAP 1S. Administer 10 units of insulin, GAP 0.5S. Encourage exercise, GAP 0.5S. Check blood glucose levels, GAP 0.5S. Notify the healthcare provider, GAP 2S. The answer is check their blood glucose levels. This will give you a clear picture of their current condition. You need that blood glucose reading to determine the severity of the hypoglycemia and guide your next steps. Accurate readings are essential for effective treatment. If it's a mild case, you might offer them a sugary drink or a snack. This can quickly raise their blood sugar levels and alleviate symptoms. But if it's more severe, they might need intravenous glucose. Administering IV glucose can rapidly stabilize their condition and prevent further complications. The next question concerns warfarin and coagulation. We will delve into the intricacies of warfarin, a medication that plays a crucial role in managing blood coagulation. Alright, let's talk about warfarin. This medication is often prescribed to prevent blood clots, which can be life-threatening if not managed properly. Warfarin is a powerful anticoagulant, meaning it helps to prevent the formation of harmful blood clots. However, it can be tricky to manage because it significantly affects how our blood clots. The key to effective warfarin therapy lies in careful monitoring, but it can be tricky to manage because it affects how our blood clots. This is where regular blood tests come into play. Which lab value should you be keeping a close eye on to make sure the medication is doing its job without causing any harm? Your options are platelet count, prothrombin time, PT and INR, activated partial thromboplastin time, APTT, white blood cell count. The answer is prothrombin time, or PT, and INR. These tests measure how long it takes for blood to clot, providing crucial information for adjusting warfarin dosage. These tests measure how long it takes for blood to clot. Warfarin works by making it take longer for blood to clot, which helps prevent those dangerous clots from forming. Warfarin works by making it take longer for blood to clot, which helps prevent those dangerous clots from forming. The INR standardizes the PT results, ensuring the warfarin is working effectively and safely. Monitoring the PT and INR is crucial for finding that sweet spot where the warfarin is doing its job without putting the patient at risk. Too much warfarin can cause excessive bleeding, while too little can lead to clots. Too much warfarin can cause excessive bleeding, while too little can lead to clots. Therefore, regular monitoring and dosage adjustments are essential for safe and effective treatment. Next question is on the topic: chronic obstructive pulmonary disease and oxygen therapy. Let's talk about COPD, or chronic obstructive pulmonary disease. This condition is a major cause of disability and is the third leading cause of death in the United States. It primarily affects older adults and is often linked to long-term exposure to irritants that damage the lungs and airways. COPD is a group of lung diseases that make it hard to breathe, and oxygen therapy is often a key part of managing this condition. Oxygen therapy helps to ensure that the body gets the oxygen it needs to function properly, which can significantly improve the quality of life for those with COPD. You have to be really careful about how much oxygen you give them. Monitoring oxygen levels is crucial because too much oxygen can actually be harmful. Excessive oxygen can lead to a buildup of carbon dioxide in the blood, a condition known as hypercapnia. This can cause confusion, headaches, and even life-threatening complications. So, which oxygen delivery method is the safest and most effective way to prevent that dangerous carbon dioxide retention? Your options are non-rebreather mask, simple face mask, Venturi mask, nasal cannula. The answer is a Venturi mask. This mask is designed to deliver a precise concentration of oxygen, which is crucial for patients with COPD. This type of mask is specifically designed to deliver a precise concentration of oxygen. It ensures that the patient receives the exact amount of oxygen needed without the risk of over-oxygenation. The Venturi mask ensures that the patient is getting a consistent and controlled amount of oxygen. This helps in maintaining the delicate balance required for effective COPD management, making it an essential tool in respiratory care. And there you have it, future nurses. We just tackled a few of essential NCLEX RN practice questions together. How did you do? Remember, the more you practice, the more confident you'll become. Keep hitting the books, keep reviewing those rationales, and most importantly, believe in yourself. You've got this. Don't forget to smash that like button and subscribe to our channel for more awesome nursing content. Share it with your study buddies. Let's ace this exam together. Keep up the amazing work, and I'll catch you all in the next video.